in patients with BRCA mutations, platinums and PARP inhibitor drugs are certainly a focus of huge interest and research and trials at the moment. PARP is an enzyme that's involved in DNA repair. And so that's essential for a cancer cell to grow. It has to be able to repair its DNA. Individuals who carry a mutation in the BRCA gene, they're deficient or in a particular DNA repair mechanism. And this is called homologous recombination. So homologous recombination just doesn't work. And so as a result of it not working, the cells depend on a different mechanism of DNA repair. And that different mechanism that they're very reliant on is called base excision repair, and that relies on this enzyme called PARP. And so we know that if these cancer cells are relying on PARP, then what if we go in and inhibit PARP? And how you would do that is with a PARP inhibitor, and that process is called the synthetic lethality. The EMBRACA trial is a trial specifically designed to test a PARP inhibitor, its activity in patients with metastatic breast cancer who carry a BRCA1 or 2 mutation. These patients will be randomized to talazoparib, the PARP inhibitor, or the physician's chemotherapy of choice, which include a number of different agents, vinorelbine, capecitabine, eribulin, or gemcitabine. So patients will be randomized in a 2-to-1 fashion to either the talazoparib or to chemotherapy. It's important to understand that a patient who may be eligible for this study may not have had BRCA testing. So really anybody in your practice who has metastatic breast cancer, who you may suspect but may not have yet tested whether they have a germline mutation in BRCA1 or 2, will be tested as part of this clinical trial. So the patient will have testing done and results should be returned within 10 days. It works in a slightly different way from other PARP inhibitors in that it inhibits the enzyme component of PARP, but it also attaches on to the DNA strands and blocks the activity of PARP that way. So this dual mechanism of action seems to be contributing to its very potent inhibition of PARP. So from the early clinical trial data, the safety profile appears quite predictable. The main side effects seen have been myelosuppression, some nausea, alopecia, fatigue. So they appear quite predictable and manageable side effects from this oral agent. If this study is positive, and we hope it will be, and certainly the results from the phase 1 and phase 2 studies look very positive. So if it is positive, it will have enormous implications for people carrying germline mutations in BRCA1 or BRCA2.